This project focuses on the phenotype creation and exploration in refractory epilepsy patients. Epilepsy is a pervasive disease that affects over 50 million people worldwide. Unfortunately, 30% of these patients do not respond well to medications and are considered refractory. Little is known about this set of patients called refractory patients. It's very difficult to identify this population because you do not know a patient is refractory until they have already failed multiple drugs. This is very costly and uncomfortable for the patient because they have to fail many different drugs while living with their symptoms until they can determine that they are refractory. This project will focus around determining the refractory population and then clustering them into medically significant phenotypes. Once this is done, a visualization platform will be created that will allow clinicians and analysts to further investigate the refractory population. For the first part of this project, a refractory cohort will be determined from the population. To be in this cohort, a patient must be diagnosed with epilepsy based upon specific diagnoses codes and also fail 3 unique anti-epileptic drugs, or AEDs. Once this refractory cohort is determined, patients will be grouped into phenotypes using the Marble tensor factorization algorithm. These phenotypes will be derived, and then once these phenotypes are derived, they'll be further clustered into medically significant groups using a hierarchical clustering algorithm. Then a visualization platform will be constructed that can be used to further explore the phenotypes. The first 2 visualizations, the phenotype graph and hierarchical clustering tree, are used to inspect the results of the clustering algorithm, and the last 2, the AED failure Sankey diagram and grouped AED diagram, are used to further explore the AED progression of these patients. The first diagram you see are the results of the Marble algorithm. 20 phenotypes were derived and further grouped into 4 groups that you can see by the different colors. The size of a node represents the number of patients that are in the phenotype, and any link between 2 nodes represents the cosine similarity between these 2 phenotypes. The features for the cosine similarity are the diagnoses and medications that are significant in this phenotype. The visualization you see here is a tree that shows the hierarchical clustering that was performed. The length of the branches represents the strength of the cluster. For example, the 2 nodes at the top have one of the strongest matches because they have the shortest branches until they get to a node. The next visualization you see is the phenotype exploration. This shows the AEDs for a given patient. Each black box represents 1 patient, and the colored rectangles inside the box represent the AEDs taken by that patient. The legends from 0 to 1200 represent the number of days. This visualization can be used to look at all phenotypes, or it can be used to delve into a specific phenotype. The values can also be sorted by length of AEDs, number of AEDs taken, most AEDs taken at one time, as well as the density of AEDs taken. These values can also be sorted ascending or descending. The final visualization we have is the AED failure Sankey diagram. Each link between 2 nodes represents a failure or a switch from one AED to another. Again, like the previous diagram, this can be used to look at all phenotypes or very specific phenotypes. In addition, the number of drugs can be filtered to include the top n number of drugs. For example, what's shown here is the top 6 number of drugs are shown. Clinicians can use this to understand what are common progressions for AEDs. The AED colors are consistent between this visualization and the previous page. In conclusion, refractory epilepsy is not well understood. Hopefully, through visualization tools and phenotyping like this, refractory epilepsy can be better understood. Unfortunately, there's no ground truth for phenotypes. The only thing that can be done to further understand these is tools like these can be used to get clinician feedback and support and verification for these phenotypes, and they can be improved.